Hello, 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 everyone. Welcome to another amazing session of Ask Dr. Dansinger with Dr. Michael Dansinger, who wrote the famous Tufts University Diabetes Reversal Program. And he has gone on to work with patients in New Hampshire, Massachusetts, and Florida with his diabetes reversal partners. It's covered by insurance, by the way, if you are in those states, hoping to expand across the country. I thought this would be a great opportunity to talk to Dr. Dansinger about his work in diabetes reversal, how he got started, how his research has really set the precedence for so many different programs across the country, if not the world, including his own. And I want to talk about the effectiveness. What makes a diabetes reversal program so effective? Because there are research studies that prove that creating a good lifestyle modification program, diabetes reversal program, can have an even greater long-term impact than even medication, even those GLP-1 medications. So, welcome, Dr. Danziger. Thank you so much for joining us. Hopefully, everything I've said has been accurate.
Absolutely, Kim. Thanks so much for the opportunity to have this conversation. It's going to be a lot of fun and very informative for the audience.
What sparked your passion for diabetes reversal in particular?
Yeah, thanks for asking. I've been a physician for over 25 years, and I trained in primary care internal medicine. And for several years, I saw patients in primary care who um, I was concerned about, diabetes and their weight, but I felt ineffective to help them. And my training in primary care and the setting of primary care clinics was just not designed to help patients really make nutritional changes and lose weight. And I, like many of my colleagues, just felt increasingly defeated by these lifestyle diseases. And after a while, I realized, oh, the healthcare system is broken everywhere in the United States, and I'd like to get to the root causes of some of the things that are breaking the healthcare system in the United States. And so I realized we have to do a better job with these lifestyle diseases. So that brought me to Boston, to Tufts University, where I participated in a 3-year nutrition research fellowship to get training in how to use food as medicine and how to focus on these lifestyle diseases, cardiovascular disease, obesity, and other weight related diseases like type 2 diabetes. And so through my research and training in nutrition, I gained a lot of insights onto how we can use food as medicine to prevent and reverse these conditions. And I've been an enthusiastic lifestyle physician for over 20 years now.
What are the fundamental findings in your research at Tufts University and the diabetes reversal program?
Yes, so as a research fellow, I had the opportunity to do randomized trials to test different eating strategies. And I wanted to know what is the best eating strategy for reversing type 2 diabetes and obesity and risk factors for heart disease. And so I was able to randomly assign 160 patients with diabetes risk factors and obesity to one of four very different eating strategies: the Atkins, very low carb; the Zone, moderate carb; the Weight Watchers, moderate fat; and the Ornish, very low fat vegetarian eating strategy. And patients followed their assigned diet for up to a year, and they lost weight and they improved their blood tests, but only to the extent they could follow their eating strategy. And what we saw was that there was no one best eating strategy for everybody, but the more closely you stuck to the eating plan, the more you improved your risk factors for diabetes and the more weight you lost. And so the findings which were very novel when they came out in 2005, published in the Journal of the American Medical Association, really helped change the way doctors and the healthcare system think about diet. And now everyone embraces the idea that there's many good eating strategies. There's not one best one for everyone. There's no single diabetes diet, for example. But the challenge is finding one that the patient can stick to. And if you can stick to an eating strategy that's well matched to you as an individual, that's when you see results. And so I've spent the rest of my career trying to figure out how to do the matchmaking and how to help people stick to the plan that's a good one for them.
And I want to get to what exactly diabetes reversal means because it is certainly not a cure. And I also want to differentiate between type 1 diabetes, which is not reversible, it's manageable, not reversible, versus type 2 diabetes is really what we're talking about here as being reversible, not a cure, but reversible.
Yes, great questions. Great point, Kim. So, type 2 diabetes is in most people associated with excess body weight. And for those people with type 2 diabetes, weight loss, if they have weight to lose, will improve their blood sugar control and help reverse their diabetes. And for many people, there's a certain weight that they can achieve where the blood sugar is normal without medication. And so we call that remission of type 2 diabetes. Most people with type 2 diabetes, if they have excess body weight, have the potential to achieve remission of their type 2 diabetes. And um, when I talk about diabetes reversal, what I'm talking about is the process of getting to remission or as close to remission as possible. So that's what makes a diabetes reversal program. It's a program designed to help people lose weight, manage their blood sugar, minimize the amount of medication it takes to have normal blood sugar. And in some cases, in many cases, patients have been able to discontinue all their diabetes medication, including metformin. And so patients come to me for diabetes reversal coaching. And even though not everyone gets all the way to remission, when we reverse the diabetes as much as possible, everybody benefits from that.
It's interesting. I was reading some stats I have here. Diabetes reversal programs can potentially reduce all kinds of monthly costs by decreasing the medical medication dependence and improving the overall health of a patient. A 2023 analysis reported that 73% of diabetes patients have average monthly out-of-pocket expenses over $100 related to their condition. 16% reported spending over $300 and 10% over $500 monthly. So isn't it worth it to start taking steps to better health and improving your diabetes? Wouldn't you think?
Yeah, 100%. And that's part of the reason why I'm so jazzed up about diabetes reversal. So when people are improving their diabetes, everybody wins. So I love it as a career ambition. The patients like it because they like the results, and patients start to save money. But the big savings is actually the whoever is paying for expensive medical bills is the one who saves the most. So in most cases, this is insurance. For example, Medicare or Blue Cross Blue Shield or Humana or United Healthcare. So because they're the ones who spend money to pay for diabetes treatment, they're the ones who save money the most when patients improve their care. And most of those savings comes from avoiding expensive medications like insulin or Ozempic, for example, or most diabetes medications are very expensive, and to avoid those is cost saving. Also, by helping people stay out of the emergency room or avoid hospitalizations for infections or diabetes complications or heart attacks. So it not only are patients helping themselves save money, but they're helping the United States and healthcare companies in general, and we all win. We all save money when diabetes is reversed.
Yeah, in a recent diabetes reversal program by Banner, Aetna, and Virta Health, participants experienced, on average, a drop in A1C of about, or should I say, improvement of A1C. Yes, it would be the same thing, of 1.4% after just 6 months. And by the end of 1 year, participants were able to eliminate 66% of their diabetes medications, excluding metformin. Almost 60% of individuals on insulin were actually able to discontinue its use entirely. And insulin has been something that I've been very concerned about when type 2 patients are put on that too early, because you end up having to then balance so much more with your diet and your lifestyle, to make room for or adjust everything to your insulin, including eating more carbs than, let's say, you would if you weren't on this insulin. But also, here what's, and I'll have you comment on that in a second, but here's what's one more thing that's interesting from that study: the risk of long-term diabetes complications can be reduced by 40% for each 1 point drop in A1C. That is huge. By 40%, your risk of limb loss, your risk of sight loss, and your risk of cardiovascular issues and life lost due to blocked
Yeah.
arteries in your heart due to the damage caused by just even one sugar molecule, reduced by 40%.
Absolutely. So, yes, diabetes is very sensitive to lifestyle change. You can do a lot, and it's even more potent than the medication. So, lifestyle change is the frontline treatment for treating and preventing diabetes. And an A1C drop of 1.4 points is about what we see in the most effective programs. So not every program is good enough, skilled enough to help people achieve a reduction of 1.4. So an example of an A1C going from 8.0 down to 6.6, for example, would be a nice, really solid improvement in your
Yeah.
A1C. That's the type of improvements I'm accustomed to seeing, but the program needs to be intensive and really give patients the support they need in order to figure out how to eat healthily on a day to day, week to week, month to month, year to year basis. And so when that happens, yes, you reduce your risk of dialysis, blindness, limb loss, and premature heart disease by a huge amount.
And here is something else that I found so surprising in my research. Well, new medications like GLP-1 receptor um, agonists are effective, they have a high discontinuation rate as compared to lifestyle management strategies such as low carb diets have actually shown sustained long-term benefits compared to pharmaceuticals. And I just would think that's a little bit, um, it just doesn't seem to be what I would experience, in that I would think that patients would be more apt to sticking with their pharmaceuticals versus having to um, change their lifestyle. Because most of the patients will come to me and be like, shoot, I'd rather just take a pill, I'd rather take an injection than have to stop eating my donuts or cookies or whatever I'm in my big hamburger, whatever, or French fries, whatever I want to eat. But this is saying that people, if they get the right strategy for eating, they're more likely to stick to that than they are continuing with their medications.
Yes. So I am an advocate. I have positive things to say about the GLP-1 receptor agonist drugs like Ozempic and Mounjaro, and many patients have had success when they've been stuck despite lifestyle change by taking these medications. But these medications have side effects, and the benefits wear off when you stop taking them, and they have side effects. So many people discontinue those medications within a year or less for one reason or another, and they don't in themselves change the your skills at sustaining healthy eating strategies. They just reduce your appetite. So, what many of my patients who have been prescribed by other doctors to take the weekly injections are aiming to be able to achieve their diabetes control with the minimum amount of medication needed and to learn strategies for discontinuing the weekly injection as soon as possible. And so people tend to, you know, regain their appetite and when they discontinue the medication. But if they've learned how to eat healthily, more vegetables, for example, and healthy proteins, and stay away from processed, refined carbohydrates and animal fats, they are able to maintain most or all of the additional weight loss that they got from those medications. And so the two are both beneficial, but I if you do Ozempic or Manjaro without lifestyle change, then that's really a limited, only a partial benefit to a patient.
I don't want to cause trouble here, but yes, I do. What is the difference between working with a general dietitian and one-off dietitian and one-off appointments versus getting enrolled in a diabetes program such as Virta Health or a program like yours?
Okay, great question. So I have positive things to say about dietitians, and dietitians are limited in some ways that I, as a MD, am not. So first of all, you know, I have a lot of freedom to personalize the eating strategy, including all the way to the extremes. And then, for example, a ketogenic diet, or very low fat vegetarian diet, or a nat or a you know the so I feel comfortable and confident to embrace a much wider range of different eating strategies than I think most dietitians. But also, I have the freedom to provide a level of intensity and insurance coverage for a lot more visits. So dietitians often are limited to having, 2 or 4 visits covered, and limited to patients, say, with diabetes or kidney disease, rather than a much broader range of just medical conditions. And so much of the degree of freedom and uh, is dictated by insurance reimbursement. When I see a patient, I can see that patient, every week for months and months and months. And because they're seeing an MD, I think it adds a lot of um, the credibility. It just comes with a automatic credibility, and also the fact that I have 25 years of experience. I'm older than most dietitians, and so
Oh, pulling the age
some,
rank there.
sometimes a
Older
patient.
and wiser.
Some of my 70-year-old patients say, "Yeah, I saw a dietitian who was 22 years old, and I felt like I just couldn't relate." And I say, "No, you do what it takes to relate to your dietitian, but I can see how sometimes it I- you have an advantage as an MD." And it's a shame that more physicians don't do this kind of intensive lifestyle coaching, because I think it's a great way for um, physicians, and also um, uh, nurse practitioners and physician assistants to practice medical care. And so it's been a great way it's been a very satisfying career for me. And I'd love to see more clinicians getting into it.
Yeah, versus just prescribing medications. But that's also an advantage that you do probably have more experience as well with the medications, and you can prescribe medications if need be.
Oh, yes, I can prescribe any medication, but I have designed my career to avoid and to help people reduce their medications rather than to increase their medications. Yes.
So what kind of support is typically provided, during these types of programs versus, let's say, just going to, and I don't want to pick on dietitians because we work with a lot of dietitians and I think they do have their role. And I think they are limited by design within the healthcare system to only see a patient once. For example, with my dad, when he was diagnosed with heart disease, they provided him with one session with a dietitian. And that one dietitian, that poor dietitian, had no other support. They only had three dietitians in the entire hospital system. And so he couldn't get another appointment till 6 months later. And all she could do during that appointment was do a few, get the doctor to order some blood tests, and follow up with some worksheets on here's what you can do on your own. But my dad got 1 hour every 6 months with a dietitian, and that just did not work. So that's when we turned to going to a functional medicine practitioner for him, who was also an MD, who could better personally design a diabetes reversal program and heart disease reversal program that fit his lifestyle.
So when I work with patients, I it's all through insurance. And so most patients that I work with have zero out of pocket. It's already paid for. I'm mainly working with Medicare patients or Medicare Advantage PPO patients. So most of my patients are over 65 and they have type 2 diabetes or risk factors for diabetes, like such as obesity or prediabetes. And I meet with them for an hour, and during that time, it gives me a chance to get to know them not just as a list of medical conditions, but as a real person. So I want to know, what they've done for work, if they live with anybody, eat with anybody, whether they have children or grandchildren. That sets a good foundation for our future relationship. Then I want to know about their medical situation and their health goals. I want to know all their medications, and they can see that I'm taking notes during this initial visit. But I'm looking at them in the eye. I'm not looking at I'm not busy writing my note while I'm having this, initial conversation with the patient, and that helps bond us together. And then I tell them, I when the timing is right, they are ready to hear more about me and my approach and how I've been able to be successful with other people with diabetes, and then we map out some goals. I say if we're going to work together, we would, these are some goals that we can agree on. And then when we're on the same page and have the same goals in mind, then that frees us up to create a plan to do that. And then to make the plan work, in my view, we need to meet once a week, not for an hour, but for 20 minutes. And again, these visits are billed to insurance. And then we spend a lot of time talking about food and, optimizing an eating strategy. I ask them to keep a food log so I'm not blind to what they're eating. And I often teach them how to show me pictures of their meals. And week by week, they get more skillful at following through with an appropriate eating strategy that's tailored to them. And as they lose weight and are lighter on their feet, they can start exercising and they're in a positive cycle. So getting people into that positive cycle and then helping them perpetuate that week after week, no matter what gets in their way, that's how intensive lifestyle coaching programs work. And that's really what's needed in the real world to help people lose enough weight and eat better so that they can get their A1C all the way down close to 6.
And the great thing is the patient doesn't have to go anywhere. It's virtual with most of these programs these days. They're just either through an app, they're through Zoom, they're through Microsoft Teams, whatever it, or some EMR system, whatever it might be. But what is the cost ultimately to the patient? It's covered by insurance, but I would imagine, especially on a weekly basis for a lot of these programs, there's probably a copay, which is different for everybody depending on their insurance coverage.
Great question. For people over age 65, they receive Medicare from the government, and about half of the people keep their Medicare. That's called traditional Medicare, and they usually buy a supplement to cover all the gaps that are not covered by Medicare. So, a Medigap policy, and for Medicare patients with a Medigap policy, such as Humana or Blue Cross as such as Aetna or Blue Cross Blue Shield or United Healthcare are common Medigap policies. Those patients pay zero. It's already
Mhm.
paid for. And then for the other half of Americans over 65, they're on Medicare Advantage. So they've chosen to get their Medicare benefits through a company like Humana or Blue Cross Blue Shield or United. And there's many different types of Medicare Advantage plans, and the PPO plans for Medicare Advantage are have broad coverage for doctors like me who aren't necessarily in every network. So for those people with Medicare PPO, they have a copay that typically ranges from $10 to $30 per visit, and so um, most people are happy for the level of personalized service to meet one-on-one with an MD for, let's say, $20 per visit. And I see them either weekly or every other week. So that's what we're talking about.
And I know we have a question coming in from Douglas here about fruit, and I'll let him go ahead and unmute and ask his question. But I'm curious along with it if you can answer. We had a patient that came to us whose daughter was a registered dietitian going after her doctorate, and to reverse his diabetes, she put him on a strictly fruit diet. And it was all fruit to reduce his, which seems counterintuitive because in so many of these diets, they talk about reducing fruit. And she said the key is, well, you have to be diligent, select your fruit wisely, and be very, very good about just only following the regiment of fruit. So curious on that, but I'll let Douglas jump in as well.
My question. Good to see you again. It's great to have you with us.
Likewise.
And I'm I had my test done. I'm pre-diabetic, and she said I'm really close to it, so I really need to pay attention. But I've also been told to cut out. I'm not supposed to be eating blueberries, apples, anything. I don't need any fruit in my diet at all, none.
Okay.
And if you Google this, it's all over the place.
Yes.
He's in Texas, Dr. Dansinger. So guess where you get to take the test and get your license there?
So that's a great point about fruit. And so let me start by saying there are many different eating strategies, and each eating strategy has rules, and those rules are going to have something to say about fruit. And so for some eating strategies, fruit is almost entirely out, certainly at first. And then on other eating strategies, all fruits are in. But so when you look for guidance on fruit, it is all over the map, and that's because there's no one best eating strategy for everybody. Now, fruit is a mixed bag. Fruit is, in general, is good for weight loss, but there's some sugar in fruit. And I was nervous when I started first, got into this line of work, 20 more years ago, that fruit was going to cause more problems than it's going to help. But in general, fruit is so good for weight loss that it's worth it. And so, in most eating strategies for diabetes, fruit is in. And so, most of my patients who have gotten their diabetes into remission are eating 1 or 2 servings of fruit per day. It is possible to go overboard on fruit and eat too much, but um, different eating strategies have different rules. And so the point is, whatever the eating strategy that you and your doctor agree on, or you and your healthcare team, I should say, agree on, you want to follow that. And so, um,
Go
in
back to the sugar question. No,
yeah, so
the sugar, because I was told there's natural sugar in some fruit, which is good for you, and most fruit just have sugar. So, how do you? I mean, I love blueberries,
yes.
and they help me eat good. So
Mhm.
now I'm not supposed to have them. How do I substitute this stuff? Or what do I substitute my snacks with during the day?
Right. So Those eating strategies with no fruit, that's a major drawback of that eating strategy, but it doesn't make the eating strategy more effective necessarily to add fruit. Other eating strategies embrace fruit, and so sometimes it's a matter of switching to a different eating strategy that is more fruit friendly if you're missing berries. Many would also, so along these lines, many would say that some fruits are better than others. So some fruit definitely has more sugar than others, and we use the glycemic load of fruits. So there are tables that give the glycemic load of different fruits. For example, berries are pretty low on the glycemic load compared to grapes, for example, which pack more of a blood sugar rise. So some would say, bananas and pineapples and grapes are some of the, highest sugar fruits, whereas lower sugar fruits would be berries or citrus, for example, or melons or stone fruits like cherries. And so some eating strategies say you can have these fruits, but not others. But a very low carb eating strategy, like the Atkins diet, would say no fruit at first, and then later, as um, the eating strategy liberalizes a little bit, then berries are the first thing to come back. So when I work with a patient on a very low carb eating strategy, when it's time, once they've seen some results, once the blood sugar is stabilized, we gradually start to add in berries. And so maybe you'll get to a point where berries are on your plan.
It was interesting. My dad, he went on the extreme to the Estelin Ornish diet, and then he realized with the MTHFR mutation he couldn't do that. And then, he went to a whole other extreme. And then we finally, what really worked for him was that balanced diet. And he was told to have a cupful of blueberries with a handful of walnuts. And they said that the dietitian said, or the functional medicine practitioner said, the protein would balance out the sugars. So anytime you have, an apple, for example. So if you have an apple, have an egg with it, or an egg with an egg white, and then, or an apple with some natural no sugar peanut butter or almond butter or something like that. And that really, really worked for him. And then his non-negotiable in the evening, he loves having a big bowl of berries. Well, cut down on the amount you're eating, and then of course, again, add in some sort of protein with that. And I
Yeah.
don't know if that's something that is science based, but it did work for him.
No, it is. It is. So you could eat, yes, that's a common strategy, is to combine fruit with protein, and that helps lengthen out the you know makes the rise in blood sugar more gradual. Others would say, oh, fruit should be eaten on its own. So when you right, it depends on the rules of the eating strategy. Some eating strategies would say always pair your fruit with protein. Others would say only eat it on an empty stomach. Like I've said, there's no one best eating strategy. It has to be personalized and a good fit for the individual.
Thank you so much, Dr. Danziger, for all your time and spending a few extra minutes with us here to dive a little deeper into fruit as potential medicine for some patients. If you want to, get a hold of Dr. Danziger, follow him on his YouTube channel, youtube.com/at Michael Danzinger, MD. You can also make sure to like this video, and you can subscribe to the Global PAD Association's channel at youtube.com/at The Way to My Heart. The Way to My Heart is our 501(c)(3). But if you think that you are ready for diabetes reversal, go ahead in the comments section and actually state, yes, I am. I am ready. I am in. I'm all about reversing my diabetes, and we'll jump in to help you out. Thank you, everyone, for joining us. Thank you again, Dr. Danzinger. What is your website in case people want to visit Diabetes Reversal Partners?
It's diabetesreversalpartners.com.